Hello, is there any question?
Wala po, ma'am.
Wala? Okay. Just beep me if you have any questions.
Yes po, ma'am.
Okay. Okay, we can start now. Again, urinary catheter related to infection background. So urinary tract infection usually cause over 40% of hospital-acquired infections. And most of the infection is urinary catheters. For the patient have this catheter, right? When we observe it, we help the patient to do the hygiene. Maybe it will decrease the urinary tract infection of our patient. 25% of inpatients are catheterized. Ibig sabihin, 25% yung mga patient admitted in the hospital, they will having all Foley catheter. This is usually cause and lead for the increased morbidity and cost also of the patient. So we have to very careful for the infections due to Foley catheter. There is consequence of catheterization who have this urinary tract infection or pyelonephritis. The patient could be able to have this right micturition. Even the patient will lead to death to rule out bacteremia and damage of urethra, which is having the scarring or strictures of the patient, or prostatitis and epididymitis for the male. So yan ang consequences or risk of those patients having Foley catheter. For indwelling Foley catheter are the major source of the UTI. These are the major source of the UTI. Relationship between the duration of Foley catheter in the patient and incidence of infection. Usually, having this indwelling Foley catheter, usually the affected one is the female with advanced age, meaning to say, may edad na, nagkakaedad na, and the duration, how long it will be, and the patient have this present condition, like for example, the patient has diabetes or renal insufficiency. So indwelling catheter is very source of UTI. Risk factor, usually men with women with advanced age, old age, a duration when it used at long time, and those patients having diabetes and renal insufficiency. Now, the biofilm extracellular polymers, when you look at in the microscope, this is how it looks like. Organism attached to the growing surface and produce extracellular polymers. Your intraluminal ascent for 48 hours, collecting bacteria faster than extraluminal. Kasi meron po tayong collection for urine, also for specimen collection, which is 78 to 168 hours. The patient had given a big container to collect urine to be studied in the laboratory also. The most catheter used for 1 week have a biofilm. Extraluminal is more important for women. Now, what is the Foley catheter bundle? Insert using sterile technique. You have a hand hygiene before and after contact with the Foley catheter system. Secure the catheter in the thigh at all times. Always secure the catheter to the thigh, not on the upper part of the body of the patient. You have to keep the bag below the level of the bladder at all times. Always the catheter below on the bed at the level of the bladder of the patient at all times. You have to maintain a sterile, continuously closed system. Do not open it because it may release the urine. A specific criteria for insertion and continuation of Foley catheter also. There must be specified criteria why you have to insert Foley catheter and the continuation, why it's long time. There is also a pericare daily and after incontinent stool. So you have to clean this one with daily and after incontinent when the patient have to pass out stools. What is peri for the patient with folica? You have to daily wash it with soap. Now the gravity will help the drainage of the bladder. Gravity is important for drainage and it's the prevention of urine backflow. To ensure the catheter bag is always draining downwards, um, do not become king or shoot the below at the thigh level. So dapat it must be always on the thigh level. Metal or plastic hanger should be attached to the side of the bed. Cloth bag tied. It's also the cloth bag must be tied to support the bag when it is available, because sometimes you didn't know the bag of Foley catheter has full already with the urine. So there must be a support for the bag. For the collection of the urine from the catheters, the process of obtaining the collection from within is dwelling urinary catheter. It must be obtained from the sampling port. The sample must be obtained by using aseptic technique. The port is usually situated in the drainage tube proximal to the bag, which ensure the freshness sample possible. As soon as possible that you get it, you bring it immediately to the laboratory. Use the drainage system without sampling port should be avoided. Now, in collecting catheter specimen, especially for the urine, a urinary tract infection, those patients have this urinary tract infection, you have to clean the port with alcohol swab using the firm friction to allow the air to dry. So you have also to insert syringe direct into the point of the bag and aspirate the urine. So you have to use a syringe and then directly to the entry point of the bag and aspirate urine. the port is well self-sealed and the syringe is withdrawn. So dapat naka-sealed siya, and then you have to withdraw urine from the bag. If the syringe entry port is not available, you have to insert the needle into the entry port and aspirate the urine. The port is self-sealed when the needle is withdrawn. Dapat naka-close siya when you have to aspirate urine. It's like this. And specimen should not be collected from the top to the main. Collecting chambers of the catheter bag as colonized, multiplication of bacteria within the stagnant urine around the drainage may have occurred. Pag ganito ka nag-collect talagang yung if you collect like this, there will be a presence of bacteria because of the stagnant urine around the drainage. Now, in aspirating urine with the syringe, this is how it looks like. You have to you have to get a syringe and a needle and aspirate. However, the needle-free system is commercially available when it reduces the circulation injury. So you have to, because this is a three-way, you have to get it from the other tube. So like this. Located in the presence of urethral trauma. If the urethra of the patient, for a female one, it's a trauma already because of long time using of catheterization, it is contraindicated. Urethral injuries may occur in patients with multi-system injury, like for example, pelvic fractures or as well as straddle impacts. So, contraindicated yan ang catheterization for the patient. One must perform genital and rectal examination first. If one finds blood at the meatus of the urethra or scrotal hematoma or pelvic fracture or higher riding prostate, then the high suspicion of urethral tear is present. So once the patient have this genital or rectal bleeding, or once na in-examine siya and it's found out there is a blood in the meatus where the Foley catheter inserted for a woman, or there is an scrotal hematoma for a male, or any pelvic fracture, it is or high riding prostate, then Foley catheter is contraindicated already. Now, epidemiology of urinary catheterization. Usually 25% of hospital patients having this Foley catheter. Urinary catheterization, 25% of the patient. So 1 month of catheterization nearby will be a bacteriuric, and a long term, like for example 30 days, and a short term is 30 days. Catheter associated with nosocomial UTI, which is the patient having 80% of patient with nosocomial UTI. Nosocomial UTI, 5% per day having patient with this one nosocomial UTI. And 40% nosocomial infection will be having due to indwelling urinary catheter. This one is an example when a woman in a labor needed for catheterization. This one, you really have to put catheterization for the patient for during the labor. Reminder for appropriate urinary, avoid urinary catheterization when it is contraindicated. You avoid it. Try to discontinue catheter immediately when it is not needed, when the patient can get out from the bed and can able to pee by herself. You have to discontinue already the Foley catheter of the patient. The longer the catheter catheter is present, the higher risk of infection. So as long as the patient can vacate micturition, you have to stop it already because it lessens the risk of infection. But the longer you have to this catheterization, the risk of more infection. Urinary drainage also should always remain closed at that time. Dapat naka-close yung bag niya all the time. Because if it's open, bacteria may enter there. Now, the rapid draining leads to complication. Rapid drainage of large volume of urine from the bladder may result for hypotension also for the patient or hemorrhage. There is a clamp catheter if the volume is drained for 1,000 millimeter or greater after 20 minutes. Release the clamp and allow to drain. So, nakikita nyo sa hospital, there is also a catheter and there is a clamp. Kasi if you release that one and the patient have this volume 1,000 ml of water per 1,000 millimeters or more than that, ang patient may have resulting for hypotension or even hemorrhage. So we are putting clamp there. After 20 minutes, we release the clamp and allow the urine to drain. Repeat the clamping when the volume is higher. So if the amount of urine is 1,000 ml or greater, you have to repeat the clamping procedure again. Now, procedure for emptying catheter bag. You have to use the clean jug large enough to avoid spillage. Example, 2 to 3 liters. After emptying the bag, you have to wipe the end of the catheter's outlet with alcohol swab. You have to take down notes, the color again, the amount of the drainage. You have to record that one. Do not forget always. And the amount, how many cc, and how does it look, the color. And then you have to empty the jug carefully down and sluice to avoid splashing. Place the jug straight to the sanitizer to store dry. Constant evaluation to a continued use of catheter. Both nurses and physicians evaluate the indication of urinary catheterization. Physicians should always pump discontinued catheter that are no longer needed. Nurses evaluate the catheters to find no indication that be contact the physician promptly to discontinue the catheter. Since this one, nurses delegated this catheter for the volume. Once you see the patient is improving, he can evacuate by himself in the toilet. You have to take down notes there. The patient can get out of bed and go to toilet. So that you have to tell that one to your supervisor so that they could inform the physician to discontinue the catheter. So, important question when to remove. Should we need to remove urinary catheter in 48 to 72 hours for a smoothly post-operative patient to reduce the rate of catheter associated with UTI? So, what's the rate of the catheter associated with 48 to 72 hours? You have to remove the urinary catheter as soon as possible because it's long already. It's very long. It's usually around 2 days lang we change it already. These are the mannequins for how to teach this medicine, how to do the Foley catheter. Now, clean and wash the hands. That saves many. As a caregiver or a nursing aide or a health team, after doing the procedure, we have to clean and wash our hands to save many from. You could say to the other patient which you are going to take care of. Now, that's all for the Foley catheter. Any question?
Ma'am,
May tanong?
question. Ako
Opo.
po, ma'am. Ma'am, what is the chances that the nursing aide can handle catheterization inside the hospital?
No, you don't have any
We are
chances
not
to do.
allowed, right? Yeah,
You
we
are
are
not
not
allowed.
allowed.
You could observe, or they will ano yung ang gagawin ninyo ay you only have to take down notes for the caller,
Mm-hmm.
for the like for example monitoring like that. You have to
Mm-hmm.
document that one, and then you have to give the result uh, for the nurses. But doing
Okay.
the catheterization,
Okay.
a nursing aide don't have any chance. Only for
Yes.
taking care for the samples, for
Mm-hmm.
the consistency of the urine, kung na-out na ba
Mm-hmm.
yung Foley catheter niya, or if it's moving, if
Mm-hmm.
it's there any problem like that. That's the time.
Mm-hmm.
You are the one you will be only with us to help us. But ang ginagawa lang
Mm-hmm.
sometimes, can you please bring us this kind of Foley catheter? Ganun ba? Pag in the
Mm-hmm.
hospital, bring
Okay,
me,
ma'am.
that's why I'm showing you what kind of Foley catheter. Bring me a three-way catheter, like that. They will just only tell you what this is the one, but they are the one, the nurses or the doctor or the interns who are doing this Foley catheter insertion. So I have idea na kung sa home care kaya hindi ko lang. But as of the moment,
Sa
ang
home
alam
care
ko
pwede,
din,
ma'am.
pwede sa home care, oo.
Sa home care,
Even,
ma'am, nakatry ako sa male patient.
okay.
Pero ano
Kasi,
lang, mga once.
oo.
Female.
Pero yung ano po,
Because,
talaga po, 3 days,
ano po?
yung pong pagpalit talaga po ng catheter, 3 days, ang pinaka, po niya.
Longest one, oo. Hanggang 48 hours.
48 hours. Dalawa.
48
Okay.
hours. Kasi pag more than that, there is already bacteria or any microorganism that can be present in that Foley catheter. At saka kaya there is a trauma in the meatus of the lady, or for the penis for the male, because of this insertion again. Once it will be out, you have to replace it again. That's why for male, most of them they like is the condom style Foley catheter. Pero yung sa babae talaga, ang really very hard for them because you have to insert it talaga.
Talaga.
Okay.
Ano pa po? May tanong pa?
Wala na, ma'am. Ano po
Okay.
sila?
So if there's anything you have to ask. Also, I remember sometimes if there is no choice like that and you are the only caregiver at home, you were given also a chance to do that one at home. Because the patient, in case of emergency, and then you also you have these skills for, like for example, this one we are also studying it, and then may mga tayo, you are also given a chance, but only in the setting of home. But most of the time in the hospital, you don't have any chance. It's all from the nurses and sa mga doctors po. Pero yung mga you will able be with them, present with the nurse, or with them, kasi ikaw ang may hawak ng mga yung mga kailangan, yung mga gadgets, or bring me normal saline, bring me like this. So you were there and you nakikita mo and you are seeing it, how they do it. But we are not allowed to do it also. That's why. For the nursing care and even the caregiver. Only maybe in an at home setting you could do. Okay, now we'll go to constipation. Last time we do this suction ba yun? Hindi. Now the continuation, because last time I'm looking for this one, I was not able to see. Now we'll go now for constipation. Now, what is constipation? Constipation is a hard, dry bowel movement, usually fewer than 3 times a week. When a person were not able to move his bowel at the daily basis, So, nangyayari every 3 days, you have to remove your bowel and it's become hard already and you are constipated. Usually, the signs and symptoms of that one is very painful when you release it. For a painful bowel movement, you are always be bloated, you are always uncomfortable, and you are sluggish. As a rule, if more than 3 days without passing a bowel movement, the intestinal content may harden and a person may have difficulty or even pain during elimination. That is why we have to train our intestine or to pass daily. I remember before when I was not um, passing that regularly, I try to sit in the sa inodoro. You have to, even though you are not releasing it or you are not removing it. Just you train you train yourself sitting down daily there, and then at least it may come, and yourself you sit and it may come regularly, and you have to increase also fluid intake. You eat pass out your bowel kasi mahirap yung hindi usually those person who are not passing yung bowel, karamihan prone yan sa mga cancer. So nagkakaroon impactation of feces. So better, even though you train yourself to sit down and then try, maybe how many weeks it will come also. There is a certain time for you to sit. It must be daily, same time, like that you will do it, and then you will pass. And then strain during bowel movement or feeling of incomplete evacuation may also reported as a constipation. Pag incomplete, hindi kompleto, you just pass only, not all. This is also incomplete evacuation. And also, known as also constipation. Kasi putol-putol siya eh. What are some common misconceptions about constipation? The bowel movement every day is necessary. Yeah, that is it is really necessary to move, constipate daily. That waste stored in the body are absorbed and are dangerous to our health. It shortens the lifespan. So we have to remove the waste in our body because this is very dangerous. It shortens our lifespan. The misconception can lead to a marked overuse and abuse laxative.
Yes.
So there is a question: is constipation serious? So it is a signal that can be only noticeable symptoms of a serious underlying disorder, such as cancer. That's why I tell you, if you are not passing every day, you have to train yourself, even though in few days like that, nothing happen, it will come also until it may, yung ma-use na siya, and then you will pass it. Because the constipation is a serious thing. Ang complication niya is hemorrhoids. Also, if there is a fissure. Now, constipation is a symptoms or a disease. Hindi, actually, ang constipation is not a disease. It's a symptoms only. Yeah. Ano ang causes ng constipation? What are the causes of constipation? We eat too little of fiber. And we are not drinking enough of fluid. And even the fluid that we are drinking is cold, carbonated drinks. So it becomes hardened the stool. So we have to drink water. We lack also exercise and physical activities. So if we lack exercise, physical activities, because we are always busy at work and we don't have time anymore to do exercise or do physical activities like that, at least you drink enough water, enough fluids in our body, it may compensate also. And then you have to eat fiber, you eat vegetables, it's good fruits and vegetables. It's very good for us to evacuate our to evacuate. Now, what causes constipation? Change in routine. Usually, when we go on travel, we're not able to pass already. We are already constipated because we are excited to the place that we are going. We are forgetting, and also constipation is may cause also for the older age person because they have a very slow metabolism. They will not able to metabolize the food that they were eating already. So, nagiging harder na yung stool nila at hindi na sila nakakapag-pass ng bowel movement nila. And frequent use of laxative also, it can cause constipation. And certain disease like or a condition also can cause constipation. Now, what causes constipation? The medication also for this one is medication that we are taking, like for example, when we have pain, we have narcotics. Antacid containing aluminum also. Antidepressant also when we are taking. Iron supplements, diuretic or water pills. These are the medication that can cause also constipation for the patient. Number one, pain, which is pain for narcotics. Example, antacid containing aluminum. Like for example, yung mga maalox na yan. Antidepressant also. Iron supplements, di ba? Pag uminom tayo ng mga iron, nagiging hard yung stool natin. And even the color changes. And diuretics. And diuretics, water pills.
Question,
Now, the
ma'am.
other, okay.
Ma'am, ang patient ko kasi, siguro in 1 month, she is experiencing constipation.
Oo.
Pero umiinom kasi siya ng iron, tas ang color ng stool niya, minsan black.
Green, black. Black stool.
Yes, ma'am.
Oo.
Okay.
Oo.
Naintindihan ko
Ayun
na.
yung niya. Pag once na
Side
ayun ang
effect.
effect, yung side effect niya. When you are taking
Okay.
iron, ang
Mhm.
kadalasan niyan, your stool will be black or
Mhm.
dark green like that. And
Okay.
it represent also, as I read also, that when your stool is, nagiging effective yung medicine kasi yung kulay niya, ganun ang color ng mo. But if the color of the stool is not that way, like nagiging yellow or mga the medicine, it's not used in a proper way that she is taking. Now, the other causes is imaginary constipation, irritable bowel syndromes. When you have a poor bowel habits, this is the one usually people have a proper way of bowel movement. But because of poor bowel habits, we are always hurrying up like that. We are forgetting to evacuate our bowels. So if we have habit, like for example, when you wake up in the morning, you have your breakfast, and then before you go to bathroom, you go to bathroom before you take a bath, you try to sit few minutes, and then like that until maging regular na, it will come out the bowels. And also sometimes hormonal disturbances. Also pregnancy. Pregnant women, they always have constipated also. Fissures or hemorrhoids. If there is some, like for example, tearing or anything problem in the anus also. If there is a mechanical compression also. These are some causes of constipation. Now, what can you do? Now you have to eat more fiber, more beans, whole grains, and bran cereal, fresh fruits, and vegetable. But you have to limit foods with no fiber. Like for example, yung mga cheese, meat, sweet, processed food. Yan ang nakakapag-cause ng constipation. So what you do, you have to increase more beans, whole grains, and bran cereal, fresh fruits, and vegetables. Limit cheese, meat, sweet, processed food. Now, Another thing is that you have to drink more water and other liquids. Yung mga juices like that, you have to drink more. Be sure that you drink at least 8 to 10 glasses a day. Every day, you have to drink that one. Water is and it releases yung mga stone or any particles that can lead us to infection or even for illness. Liquid help us to keep the stool soft. If you drink too much water, it will soften the stool, and we become more physically active. Hindi ka sluggard na, become more active. You have to allow yourself to have the bowel movement. If you get in hurry and ignore the urge to have a bowel movement, it can cause constipation. So if you feel the urgency to have this bowel movement, you go directly. Do not delay it, because if you delay it, it will not more and it become constipated already. Fiber supplements. These are the best choice. Absorb water and make stool softener, yung fiber supplements. Safe to use every day, these fibers. You have to give the patient laxative only if it's necessary. Usually, there are some patients that I think they still become impacted also. We give them laxative for them to vacate. Laxative also can cause poor absorption of vitamins and minerals. So it loss of water, sodium, and potassium, and also can damage your intestine. That's why laxative can be given only if it's necessary. So it's better to do the natural way for yung para ma-release yung bowel movement, rather than to do the curative. It is good also, it can help also, but sometimes there is effect also. Like the laxative can cause poor absorption of vitamins and minerals, and loss of water, sodium, and potassium, and damage to your intestine. Now, there are some pharmacological management for constipation, which is usually we give this patient who has been chronic really hard constipated already. We give them a laxative, cathartics, or purgatives.
Pampurga.
Laxative or cathartics or purgatives promotes to soften the stool. Cathartics result in a soft to a watery stool with some cramping. So, mas mahirap yan. Purgative also is a harsh cathartic, causing watery stool with abdominal cramping. So, but it's better to have this normal one. Kasi pag nag-abdominal cramp ka, it's also painful also you. So, it's better to do the natural way. Now, laxative, types of laxative according to their mode of action. There is a bark-forming laxative, osmotic laxative, stimulant laxative, and fecal softener and lubricants. Now, the bark formatives, I just only put it here because something it's not already for at least you know how or the things to be needed also. Yung natural, and there's also synthetic laxative. Now, the mode of action of this laxative is it absorbs water into intestine, increasing fecal bulk and peristalsis. So, once na absorb yung laxative sa abdomen natin, sa intestine natin, nagkakaroon na siya ng peristalsis. So, nag-move na siya, it dissolve, and as well in the nag-stimulate na siya ng peristalsis. So, yun ang ng laxative, mode of action niya. Ang pinaka-onset niya for you to vacate is onset for 8 to 24 hours. Ang pinaka-peak day is 3 days. You will vacate. Now, the benefits of bulking-forming laxative are not absorbed from the intestine into the body, safe for long-term use. It is safe for elderly patients. Usually, we give this one for elderly patient, and helpful for patient with irritable bowel syndrome or diverticulitis or colostomies. Now, ang precaution nga lang should be mixed in a glass of water or immediately followed by half full glass of water. Why with water or